Speaking of children, we know that many of you are making decisions about activities for your children this school year and really making decisions about what your family is going to do or not do. The Cleveland Clinic, in conjunction with Clorox, put together a fantastic resource called Safer at Home. It's available at clevelandclinic.org/COVID-19 HOME. What I think is particularly valuable is a matrix that they have come up with to help families weigh the risk of contracting COVID-19. Joining us today is the Associate Chief Safety and Quality Officer at the Cleveland Clinic, Dr. Aaron Hamilton, to kind of explain that. Dr. Hamilton, thank you very much for joining us.
Thank you, Governor, and good afternoon. I wanted to express some gratitude just to start for you and your team's leadership for all Ohioans through the pandemic. So I'm really thrilled to be able to come here and talk a little bit about a framework for people to think, families to think about as they make decisions, as you mentioned, about what they're going to be doing, returning to different activities. And as we return to a community that's looking more and more normal, the natural question is, what is safe? What is not safe? How do I make sure that I'm safe, my family's safe, my community's safe? And I think one of the things that I see is that all the questions that come up, things can get complex very quickly. And what people lack is just a simple framework to kind of make assessments about what's the level of risk. And then people are then empowered to make decisions on their own. And I think about that framework very, very simply in terms of time, space, and people. And the time part is really about time. How much time are you going to spend in activity? Is it a little amount of time? Is it a long activity? And in that same time dimension, I think about how frequently you're going to be doing an activity. So it's both the duration of time and then the frequency. So time, then space. Is this an indoor activity? Is it an outdoor activity? Is there the ability to socially distance? How can you spread out or not? Needs to be taken into consideration. And then lastly, people. And we don't think about this a lot, but I urge families and folks to consider how well do you know the people that you're going to be interacting with, and how well do you know that they're adhering to the safe guidelines that we've put out there. And I think actually President Johnson did an amazing job of outlining what some of those simple things that have been really effective for us in Ohio and across the country, across the globe. And it begins and ends really with hand hygiene and washing our hands. It's about face coverings or masks. And it's about providing appropriate physical distancing and thinking about that 6 feet, all the markings we see on the floors when we go out into the community, in our schools, and otherwise. So that's really the framework that we're asking people to use. And you can think about what is the safest thing is me or one of us or a family member seeking healthcare, whether it's well care or emergency care. Our healthcare institutions in the state of Ohio are open and they are safe. So that is on the spectrum, extremely safe. On the other end of the spectrum, you could think about a wedding that's indoor and has a lot of folks all gathered together, difficult social distancing, maybe borderline compliance with masks and shared food. That's a high-risk environment. And that's thinking about that time, space, and people matrix. So we're really urging people to think about that, to inform decisions that make it appropriate for them personally as they move forward.
So, Doctor, that's time, space, and people. Let's take a couple of it. You want to give us a couple more examples and tell us what the analysis would be?
Yeah.
I'll let you pick them.
Okay. Sure. Well, I think one of the things that comes to mind, it's certainly top of mind for those with children, whether it's going to kindergarten or 3rd grade or 6th grade or 12th grade, college, is our back to school this year is not a back to normal, right? And so we have to think that it will look and feel different, and there will be a focus to ensure safety. So this is a space from a time perspective, you're going to be going, spending multiple hours if it's in person. So that element, you're going to be spending time there, and you're going to be going frequently. Space, often an indoor activity, but schools are working to create space, limiting class sizes and creating the opportunity to get appropriate physical distancing. And then people. We know our teachers are doing everything that they can to remain safe and following all the core guidelines to stay safe. And then our friends and our colleagues, our co-students, hopefully are doing the same. So in the end, going back to school, I'm hopeful that we can, with our collective efforts, get our children and our students back to school in a meaningful way, hopefully in person over time. So that's just one example. We're thinking about that. Another example people often think about is going to a restaurant. You know, many people through the pandemic haven't been going out to eat or have thought twice about that. And I think what I ask people to do there is to understand those decisions around time, space, and people is call ahead. Find out what the restaurant's doing. Think about carryout. Think about if there's outdoor dining. And think about if employees in that restaurant are required to wear masks or not. And that helps you make a decision for you personally. I think the last thing is thinking about how we get together with our friends and family. And these can be difficult conversations. And I think it's important, I'll focus here on the people part, is sometimes, it's important to understand what our families and what our friends are doing. If they're wearing masks, if they're appropriately socially distancing, and we have to use that and incorporate that and decide, maybe it's better to do a Zoom visit or a FaceTime call with family this week as opposed to getting together in person. So we have to think about that in all the decisions we make to get together.
Let's say I decide I'm get up some morning or later in the afternoon, I decide I want to go walk on a bike path.
Yeah.
What are the variables there? How safe is that?
That's great. So me and my family, we love to use the metro parks. We go hiking almost every weekend. Time, usually not a huge time commitment. Space, it's outside, it's generally spaced apart. We might see a couple people, and we don't typically know who those people are. So what we do is when we're around folks on the path, we'll wear a mask, and we work to create social distance there. But otherwise, if we're walking or we're biking, or we're running, we don't need to wear a mask, and we feel like that's a very safe activity, particularly in our own neighborhood. But generally, we always bring it with us. We never leave home without our mask.
Now, you mentioned let's say a wedding, and let's look at the time factor. Maybe I'm not saying one of these is more or less safe, but let's take a wedding that's an outdoor wedding, and people are spread out, and let's say it's a 20-minute wedding.
Yep.
Compare that with maybe let's say a similar wedding, but now we tack onto it an indoor reception. You want to kind of walk us through some of that?
Yeah, absolutely. So that wedding that you described on the front end of your remarks sounds like a very friendly wedding in this environment to go to, and a very safe wedding. Outside, short, you generally know the folks, you're able to space out and create distance, great. The reception indoor then is a decision that I actually ask people to make for themselves. So you say, what kind of space is there? Are people wearing masks indoors or not? And you have to make a judgment call about what's comfortable for you. But clearly that's getting a little bit higher risk than actually ceremony part that you described. So in the rubric that I was describing, I think it's slightly riskier, but I think one of the things I think about, and we all should think about, is approaching the pandemic with compassion and empathy, and understanding that we have to continue to kind of live and make choices that we feel good about and are mindful of our fellow citizens. And I think these are individual decisions, and what we want to provide is that framework that makes people be able to kind of measure what the amount of risk that people are going to take on is. And I think that's the best way to take on this pandemic and to continue to kind of keep our numbers down.
Dr. Hamilton, thank you very much for joining us. If anyone wants to read more about this, where can they read more about what you're doing and maybe what you've been writing about?
Yes, absolutely. So on the clevelandclinic.org website, you described we have a Safer at Home guide. It is open access and free to anybody. We also have return to work documents. And so those are very extensive. So if you have more detailed questions, you can see where we can talk about the best way to stay safe at home and to stay safe at work.
Dr. Hamilton, thank you. We appreciate it.
Thank you. Absolutely.